Hello, this is Jane Vines, and today is our last day in London as part of the Exploring Populations Health in the UK course. I have thoroughly enjoyed my time. My favorite part of this trip has been when we visited the University of Aberystwyth in Wales. One of my favorite portions of that was hearing lectures from various faculty and learning how to frame problems that we have in our own country in different and unique ways.
Hi everybody, this is Maya in Houghton, and sadly it's our last day here in the UK, but I wanted to tell you guys a little bit about my favorite experiences in Aberystwyth. So we had the opportunity to go talk to Heather McClure at the Aber Food Bank and all the work that her and her team are doing there. It was super inspiring because Heather built the food bank right out of her time in university right there in Aber, and they're working with local restaurants and grocery stores to collect food that would otherwise go to waste to feed their community. One of the things that Heather really said that really stuck out to me was we were built a salsa with her, and we were eating the salsa and we felt bad about using 2 loaves of bread, and she told us, who is this food for if it's not for you, because the food's for everyone. And this was really inspiring, and I'm really glad we got to have that opportunity.
Hello y'all, my name is Jonathan Baker, and I am here in front of this phone booth matching it in red. So on this trip, I think the most important thing that's really brought a lot of impact to me was the Terrence Higgins Trust. So they're the largest advocate for LGBTQ rights, especially those with HIV and AIDS here in the UK. So it's just a really important thing to advocate for those who are impoverished and in need.
Hi everyone, I'm Grace Albright, and I'm a doctoral student in developmental psychology, also getting a certificate in public health. When I was little, I was very much influenced by the Dove self-esteem campaign, so it was really cool to see the behind-the-scenes workings and see it also from a public health perspective. I really enjoyed seeing how they intersect behavioral science as well as industry to develop their campaigns. They're quite influential in my life, particularly the hair campaigns. You can't tell now, but I have very curly hair, and it helped me embrace myself for who I am.
Hi everyone, my name is Rithika, Salman, and my favorite part of this trip was hearing from Professor Daryl Abernathy. Not only was he an animated speaker, but he also really brought to life the concept of One Health, where whatever we do as humans affects everything, and in turn everything in the world and in the animal planet kind of affects us as well. So in terms of public health, we really have to look to these upstream solutions and thinking about how we affect the environment as a whole. And just really harping in on those social determinants of health and just thinking about the world in a bigger way. I loved it. It was a great speech.
Hi guys, my name is Roshana, and my favorite part of the trip was our visit to the Q&I, the Queen's Nursing Institute. I think that trip really catered to my interest in health policy, and they showed us how even a public health system can have gaps and how they bridge those gaps with different programs and NGOs.
Hi everyone, my name is Maya, and my favorite part about this trip was actually going to Aberystwyth University, and lecturer Dr. Ross Thatcher discussed how the correlation between physical activity and diabetes correlate together. And as a type 2 diabetic and a PhD student, one of my dissertations it will be mental health and chronic illnesses. So I learned a lot from Dr. Thatcher, and I'm really excited to take back what I learned to my PhD program.
Hey guys, I'm Allie Marie. I'm a doctoral student studying health education and promotion. A highlight of this trip for me was visiting the National Library of Wales, where we got to have a behind-the-scenes tour of all the archival systems that have everything that has to do with Wales, from history to print, television, and even some of the more recent artwork. A really cool part about it was getting to go into the basement and get to see some of the books that they had in storage, and it included some paintings by some really famous people, as well as like one of the first editions of the Bible in Welsh, and it was just really neat to see that. And as someone who really loves literature and linguistics, it was a really cool way to learn about public health in a way that isn't normally discussed in class, and that's through like the history of archive systems, and so it was really cool to be able to see that firsthand.
Hey everyone, my name is Jessie, and one of my favorite parts about this trip was visiting the Aber Food Surplus. It was very interesting to learn about the sustainable efforts they are making to address food insecurity in the Aberystwyth community.
Hello everyone, my name is Portia Edwards. My greatest part about the trip to London is the Welcome Collection museum we visited on yesterday, and basically the museum was really interesting to me simply because it depicts the whole evolution of human health, far as how our relationship with animals, how our relationships with plants even affect our own beings, and I just love to see how the whole world of medicine and human health has evolved over these years.
Hi, this is Cassidy. And my favorite part about this trip was talking with UAB alumni Stacy June, who works with the Body Positivity campaign. And something that stuck to me during this visit was learning about how toxic body positivity has been normalized in young women.
Hi everyone, my name is Maya, and my favorite part about the trip is when we took a river cruise tour on River Thames. And I just like to say that I appreciate all the work that they have done to make the river viable again after the cholera outbreak, and the work that Jon Snow did, and also being able to visit the Jon Snow pub and seeing everything that we learned about public health come full circle.
Hey, how you doing everyone? My name's Cottrell Johnson, grad student here. Came to London for our study abroad trip with UAB. One of the most impactful things was two really. One, my first time traveling, studying abroad, first time on a plane, so very exciting. So check that off my bucket list. And my second one was visiting the Wellcome Collective Museum, just a holistic view of the world and how to look at health from a dynamic perspective. And my second one was the Queen's Nursing Institute, just looking at the way community nursing works here in London, and how even though we do a lot of different things in the US and the UK, a lot of the same weaknesses we do share, and we need to work on to rectifying them and making public health more broad and accessible to everyone. Thank you. I enjoyed my trip. Y'all have a great day.
Hello, my name is Melissa Beck, and I'm working on a master's in public health. And what impressed me the most about this trip was being in a different country and seeing all of the things that were similar and yet distinctly different between the United States and the United Kingdom. Also, what stood out to me was our time at Aberystwyth, and I'm not sure if I'm pronouncing that correctly, Aberystwyth University, where they spoke about telehealth. And I work in substance use disorder, so I was able to learn a lot about how they are utilizing telehealth in the United Kingdom and how it breaks across and reduces health inequities in terms of allowing more people to have access to tools that they wouldn't have otherwise. You don't need to depend on transportation, you don't need to worry about childcare, and it just makes things a level playing field here. So it was a wonderful educational trip, and I'm sad for it to end. So thank you for all the hard work that was done by our leaders, and we appreciate all you did for us.